Hello viewers, today we will be talking about chronic kidney disease. So chronic kidney disease is basically a clinical disorder that involves kidney damage. So there is gradual loss of kidney function and this very issue is irreversible, and there is progressive loss of kidney function. One of the basic and fundamental function of kidney is to filtration of blood. So upon filtration, what it does, it filters nitrogenous wastes, especially urea, uric acid and creatinine. Why we call them nitrogenous? Because they essentially contain nitrogen atom. They are in fact derived from proteins, and proteins are made up of amino acids. Amino acids essentially contain a nitrogen atom. So this glomerular filtration rate is around 120 ml per minute. So when glomerular filtration rate GFR is less than 60 ml per minute, and if this issue is observed continuously for a period of 3-4 months or more, then we say individual is suffering from chronic kidney disease. So in this particular disease, we can say that kidney in due course of time gets shrunken. It cannot perform, it cannot do its duty carefully. So what would be the possible treatment? The treatment which it is suggested by doctors is, why not to go for nutritional treatment. So nutritional treatment involves prescribing keto analogs. So what we have said earlier, that amino acids are the building block elements of proteins. So amino acids consist of an amino group, that is essentially a nitrogen atom is here, and other functional group is carboxyl group. This is the general structure of amino acid. So the main culprit is this nitrogen atom. So what's being done is keto analogs are prepared. So this nitrogen atom is replaced. Nitrogen atom is not recommended. So these keto analogs are basically a kind of medical food which are made from essential amino acids. Essential amino acids means those particular amino acids which are not synthesized in the body but are required by the body through food. So this would delay the progression of chronic kidney disorder or disease. So keto analogs are a kind of food supplemented in diet, providing amino acids without nitrogen or without extra nitrogen. And these could also be recommended via a very low protein diet also. So aim is to reduce the accumulation of urea and creatinine. So keto analogs are manufactured by different pharmaceutical companies, so in different dosage forms, and the most prominent dosage forms include tablets and powders. So depending upon the glomerular filtration rate and other clinical condition, the dosage is decided by the physician. Now this purpose of this video is not to promote any medicine. These medications are to be taken only under medical supervision as directed by the nephrologist. Thank you.